Hey guys, so today for our office hours, I really want to talk about crossing the legs, okay? So many of us sit like this. It's kind of comfortable. Another reason that most of us do this is to take some pressure off the back. It's a little bit, we have to be really active in our spine to sit up straight. Okay. When we sit back in a chair like this, sometimes there's just we feel like we want some support in that lower back, right? And so we end up crossing our legs. That shifts our weight over onto one hip. Sometimes, many of us cross our legs like this. Okay. So you might notice that if you're a leg crosser, which most of us are, right? Let's be honest. And I've been having a lot of conversations with clients about this lately. And I'm seeing more and more patterns that affect our body when we sit in these sustained positions that are uneven. Okay. And we're going to talk about that in a minute. But most likely, you're much more comfortable crossing one leg than the other. So if I'm going to cross my legs, I don't generally go left over right. I usually go right over left. It's just more comfortable for me, maybe because I'm right-handed. I rest on this one, I write with this one, whatever the case may be. We don't do things symmetrically, right? And so if I'm going to cross my legs this way, I'd probably do right over left. If I'm going to sit this way, I'm probably going to go left over right, okay? It feels much less comfortable for me to do this because this is tighter. It just doesn't go down. It feels awkward. So I'd like you to test that out, okay? Sit down. Just if you're not sure which leg you cross, if I'm talking to the leg crossers, just do both and you're gonna probably get a sense of which one you most likely do, okay? You're then, I want you to check this. See which one is more natural here. This for me, this leg just falls down easier. Here, it's tighter. It doesn't go down. I'm not going to do it. I'm just not going to sit that way. Okay. So why does this matter? Okay. It matters because the only hard things in our body are bones. Okay. That's simple, right? But we don't really think about it. Everything else is soft tissue. Okay. Those bones are connected to each other by lots of soft tissue. Muscles don't directly onto the bone. Muscles turn into tendon or fascia, and then they connect to the bone. Ligaments connect bone to bone, okay? Tendons connect muscle to bone. And then we have like this really big thing here, and we'll look at this in a minute, the iliotibial band, okay? And we're gonna talk a lot about this right now. So the iliotibial band is actually, it starts as a muscle, the tensor fascia lata, if you want to get fancy, okay? It starts as a muscle up into your hip, down in here. When I feel this on people and we do massage in here, it's very tender for a lot of people because it's holding a lot of stress, and I'll show you why, okay? Then that muscle turns into a big piece of fascia called the iliotibial tendon, and it goes ITB, okay? So ilio is the hip, tibio is the leg bone down here, right? Your lower leg bone, the big thick one. So it attaches your hip to your lower leg underneath the knee, okay? So why is that important? Here's why that's important. Most of us stand this way or this way, okay? So we're sitting cross-legged, most of us. And then when we go to stand, and after we've been standing for a while and we're having a conversation, we're shifting over. So whenever I'm meeting with clients and we're talking about knee, they came in because their knees might hurt, a hip might hurt, their SI joint might be sore, their lower back might be sore, might be seeing me for the shoulder, who knows, whatever it is. Whenever we're talking, I'm watching all of their patterns. Okay, so I'm checking as we're talking. We'll stop and talk. Which hip are they sliding over to? Because it's usually one more than the other. Okay, that's another thing I want you to notice. Which hip do you hang out on? right? When I had my babies, when I see people with babies, we hold them on one side naturally, and we're swinging our hips from side to side. We're always moving. That's good. That's a good thing. Okay. But for ladies who are holding their babies or their toddlers, chances are you're going to do that on one side. You're probably going to free up your dominant hand, and you're going to kind of hang over here with that baby or that toddler on that hip. Look at all that asymmetry that happens, okay? So maybe you had babies a long time ago, okay? But listen, think about this. The hormones that we have when we're pregnant, they relax the muscles and the tendons so that the baby can come out, right? I'm talking to the ladies now, right? So that the pelvis can expand enough for the baby to come out. Well, not comfortably, because that's not comfortable, but you get the point. Now, it takes a while for those ligaments and tendons and soft tissue to shore back up, okay? But while they're still really loose, those of us who have the experience of having a baby and then carrying them around, while our ligaments are still really loose, we're over here on one side carrying this eventually heavy thing all around. Now that matters, because our body, all of that soft tissue is moldable, okay? So the more that we sit cross-legged, we change the elasticity of the muscle, we change the length of the muscle, and not just muscle, these tendons, these ligaments, these fascial things, all of the connections, okay? Anytime we maintain a sustained position at rest, like we talk a lot about repetitive motion injuries in my world, in the physical therapy world, we talk a lot about repetitive motion injuries, right? Tennis elbow, golf elbow is a repetitive motion injury. If you have a bursitis, that's typically considered, you might consider that a repetitive motion injury. I consider that a repetitive sedentary issue, okay? Because that is just as damaging to our soft tissue as repetitive motion. So repetitive stillness, and when we're still for a long time, unless you're an awesome meditator and you've really practiced this posture and this position, chances are when you're sitting and you're still, even driving, we get ourselves off kilter driving. Repetitive stillness off kilter will change the shape of your joint capsules. It will change the elasticity of all of those tendons and ligaments. It'll change the efficiency of the muscles, okay? And I want to show you a little picture here so that you can see a little bit more of the inside, okay? So here we go. All right. I'm hoping that you are seeing, let me just make sure I'm sharing the right thing so I don't start talking and it doesn't equate. There we go. Okay, so I think I'll be able to zoom in on this. Okay, so this is from an amazing book that I'm looking at right now. And I'll show you the book in a minute. Okay, this is the back side. This is your butt, okay, without the muscle on it. So this is the backside view of your pelvis. And I really want you to see, because we talk a lot about muscle imbalance, right? But wow, look at these ligaments that connect these bones, okay? This is amazing, right? We have all these ligaments that connect our spine, our vertebrae. We don't think about that. We think about muscles on the vertebrae, but they're all connected by ligaments too. Look at these ligaments here that are attached on the crest of the pelvis, and they come down. It's like this like whole nother world, all this mesh and all of these things, okay? These right here are your sit bones. So that's, if you put your fingers right underneath your butt right now and you kind of found the bony part that sticks out, that's this part here, okay? When I see people with soreness in the sacroiliac joint, which means they point right here. It just hurts right here. See my butt, okay? It hurts right here, or it hurts right here, okay? That is this spot right here and this spot right here, okay? And when I feel in there on people, on that side that's sore, there's a knot. There's almost always a knot in this like jumble of tension in the tissue. So look at this. Again, we think a lot about muscle, but now picture this pelvis sitting with one leg crossed, hanging out there for who knows how long, 20 minutes, 30 minutes, an hour, you know, might be a long time because we sit more than we think we do, okay? Picture what happens to these ligaments when you're sitting, bearing more weight on one sit bone or butt cheek than the other. The legs are crossed over. There's all this reshaping happening, okay? So our bones are hard. They will dictate this movement. So if they're hanging out in this awkward off-kilter position, all of these ligaments will change. They'll change their elasticity. They'll change their tension. They'll change their resting tension. And then we go to get up and we wonder, well, why can't I move around and without being sore like I used to be able to do, okay? These things happen over time. It's a cumulative effect, okay? So same thing with that hanging out on one hip. All of these things are going to be affected, okay? When I slide over and I hang out here, this sacroiliac joint is open. This one is compressed and closed. And all of these little ligaments in there are living in a completely different state on the left side and the right side, okay? So why is this important? This is important because if we can mold and shape ourselves out of symmetry, we can also mold and shape ourselves back into symmetry, okay? But guess what that takes? That takes noticing what we're doing. That takes noticing how you're sitting. So if you are a leg crosser, you might consider not being a leg crosser anymore. And it's going to take some time to do that, okay? I want you to notice which hip you're hanging out on. It's going to take some time. This is going to, these are patterns that we don't even have any idea that we're doing, okay? But I see people all the time who are working hard to feel better. They've gotten to the point where it's painful. Something is painful, maybe along the outside of the hip, maybe that SI joint, maybe even down in the knee, the lower back. They're at the point of pain, okay? And we're doing these exercises and I'm showing them this and that, and they're like, well, yeah, I did my exercises, you know, I did them a couple of times since I saw you last. So think about that. If we're continuing to sit off kilter, if we're continuing to stand and rest off kilter, and then we go and do some stretches one day and then we forget and do them again another day, or maybe we're really good and we do them once a day, okay? Once a day is a good step, but think about the time that we spend resting into these joints and taking things out of balance. And then would, you know, 5 minutes of stretching fix that? No, it's just, no, it won't, okay? So what we have to do is we have to be aware of how we're resting, and we want to neutralize that. We have to be aware of how we're standing. We want to neutralize that. We have to think like, well, if I then did the stretches that we talked about doing, and you guys know all the moves we do in class, just take a couple of those moves and do them during the day. This one right here, right? Step forward, reach down, step to the side, reach down, open up, reach down. Think what that's going to do to all of these ligaments in here. It's going to give them some like, oh, wow, right, that's what I'm supposed to do, okay? But here's the kicker. Those things are super easy to do. If you did that every hour, right? But it might take you 1 minute, maybe, okay? Maybe 2 minutes. Maybe you want to give it 5 minutes. Who knows? But sprinkle that throughout the day so that you can remold and reshape this tissue. I've been a physical therapist for 26 years. I have not met anyone who hadn't fallen into resting positions that affected what we were working on. I mean, unless you're in a car accident or something, and that, but then your patterns are still going to come into play, even if you have a massive injury like that. So I want you to think about this, okay? I want you to do a little evaluation on yourself over the next few days. Just pay attention to that leg crossing. You're going to keep doing it. Just pay attention to it, come out of it. Pay attention to it, come out of it. Has to become a new habit and a new awareness. Pay attention to how you're sitting. Pay attention to how you're standing, okay? And give yourself the gift of moving your body so that you can reshape and remold and create new spaces, new symmetries for your body, okay? So what might I suggest that you do? All right. If you are sitting, anytime you're sitting, take a few reaches down first, okay? Let your back, like give your back something good before you settle in. And that's going to remind you not to cross those legs, okay? You find yourself crossing your legs, scoot up to the edge of the chair, reach down a couple more times, just kind of get yourself reset. Okay, easy, 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 okay? The next thing that I want you to think about doing during the day, all right? This move right here that we do in class plenty of times, get those hips moving from side to side, reach up, reach up. Why is that reach up so important? Because all of this above the hip is connected with muscle and connective tissue as well. Use your arms to get a lift there. That's why we talk about that so much, okay? Take a step forward, reach down. Take a step to the side, reach down. Take an open step, reach down, okay? Do it on the other side. The reason I did not even go out into the open space to do these movements is because you don't need space to do this. You don't need special clothes. You don't need special equipment, okay? Your chair exercise, your stepping exercise, all right? So that's just the beginning, but man, what a difference that could make if you worked those simple things into your day. And those of you who are working out with us on a regular basis with our online classes, or maybe we're seeing each other in person, I hope this is helpful for you. And you also know how important it is to strengthen and how important it is to work up a sweat at least 3 times a week, how important it is to go for walks, how important it is to stretch every day, throughout the day, just like a dog or cat does, okay? They get up, they stretch. Before they lay down, they stretch. We can learn a lot from those furry friends of ours. Okay, guys, I hope that's helpful. Make a note, make a comment down below. Let me know if there's anything that jumped into your mind that wasn't clear, or let me know how you're doing with that leg crossing. All right.